Hello and welcome to Askimo TV. I'm talking today to Dr. Matthew Wilson. Dr. Wilson is a consultant orthopedic surgeon at the Exeter Hip Unit at the Princess Elizabeth Orthopaedic Centre in Exeter. Hi, Dr. Wilson. How are you?
Very well, thank you, Joanne. Good morning.
Dr. Wilson, let's talk today about hip arthroscopy. What is hip arthroscopy?
So hip arthroscopy is essentially keyhole surgery of the hip. So it's using small cameras and instruments to perform operations within the hip. And this type of technology has commonly been performed in the knee and the shoulder for several decades, but it's really taken off in the hip recently because of new instrumentation. And part of the reason is that the knee and the shoulder are quite superficial joints, and they're also quite flat joints in that they're very easy to get into, whereas the hip joint is very deep down and it's very circular. So actually getting into the hip joint is difficult. And then when you're in the hip joint, getting around the corner of that hip joint to perform operations is quite challenging. But really over the past sort of 10 years or so, the skills and the techniques of hip surgery, hip arthroscopy surgery have increased dramatically.
Why would someone need this procedure? What types of problems can be helped?
So it's typically used for non-arthritic hip pain. And this tends to be a younger group, typically a sporting group, who present often following an injury, but not always, to the hip, commonly a twisting maneuver, or it can simply be a gradual onset of pain where an X-ray doesn't show any significant arthritis. Or it shows a certain pattern of anatomy around the hip called femoroacetabular impingement. Typically, problems in the hip can be tears of the cartilage or early signs of arthritis which aren't seen on an X-ray.
How is this procedure performed?
So typically a patient will be brought to the hospital on the day of the operation. They'll see the consultant surgeon, the consultant anaesthetist, talk over any last minute questions, and then they'll be taken to theatre and under a full anaesthetic will be placed onto the operating table in a form of traction device where effectively the leg is put into a boot and a traction is applied so that the ball is gradually eased away from the socket to create a space which doesn't normally exist. And then once that space is created, a camera about the size of a biro pen is inserted into the hip joint so that the inside of the hip joint can be assessed for any damage, and then through second small incisions, instruments and sutures can be inserted to repair any damage that's found.
What is the prognosis for this surgery?
That really depends on what the surgery is done for. Typically for a simple labral tear, a tear of the cartilage, or for treatment of femoroacetabular impingement, in which the femur impinges against the acetabulum, we quote success rates at 1 year of approximately 80% improvement in symptoms. That's not a cure, that's an improvement. Of 15% no difference, and a 5% deterioration. Now that's not to say the surgery is the cause of the deterioration. It may simply be that if those patients hadn't had an operation, they would have deteriorated with the passage of time anyway. But those are the figures that we talk about.
How long is recovery after the procedure, and will a person need physiotherapy?
So people definitely need physiotherapy, absolutely. The length of recovery very much depends on the person. It depends on how bad their situation was before the surgery, and also what was done at the time of surgery. But typically patients will start to mobilize very quickly, often on the same day of surgery, but certainly the day afterwards, and they may only be in hospital one night. Following this, physiotherapy is essential, as I've said. It really starts from about 1 week and continues for a variable amount of time, but commonly 3 or 4 months following this, with weekly and 2 weekly visits to the physiotherapist. And I always tell patients that it's very important that they sign up to the physiotherapy, because with the best operation in the world, if you don't have the right rehabilitation afterwards, it definitely won't work.
Thank you, Dr. Wilson. Thank you so much for talking to me today.
That's a pleasure. Thank you.